What is the HFE gene's role in hemochromatosis detection? Imagine a tiny piece of your DNA holding clues to a condition that can quietly damage your liver and increase your risk of liver cancer. That's what the HFE gene is all about. This gene helps regulate how your body absorbs iron from food. When it has certain mutations, it can lead to hereditary hemochromatosis, a genetic disorder where too much iron builds up in the body. Excess iron is especially harmful to the liver, causing it to become inflamed, scarred, and in some cases, leading to liver cancer. The most common mutations in the HFE gene linked to this condition are called C to80Y and H63D. The C to80Y mutation is the most significant and widespread. People who have two copies of this mutation, meaning they are homozygous, are at a higher risk of developing iron overload. Studies show that between 60 and 90% of hereditary hemochromatosis cases involve this mutation. Those with one copy of C to80Y and one copy of H63D, known as compound heterozygotes, can also develop iron overload, but usually to a lesser extent. However, not everyone with these mutations will develop symptoms or organ damage. The disease has incomplete penetrance, meaning some people with the mutations may never experience health problems related to iron overload. To find out if someone carries these mutations, doctors perform a blood test that analyzes DNA. This test looks specifically for the C to80Y and H63D mutations. It is often recommended for people with high iron levels, symptoms like fatigue or joint pain that suggest iron overload, or those with a family history of hemochromatosis. Detecting these mutations early allows healthcare providers to monitor iron levels and take steps to prevent serious complications like liver cirrhosis or liver cancer. It's important to remember that a negative genetic test doesn't completely rule out hemochromatosis. Some people may have other rare genetic variants or forms of iron overload not linked to the HFE gene. Therefore, doctors interpret genetic results alongside other tests, such as serum ferritin and transferrin saturation, to get a full picture of a person's iron status. In summary, the HFE gene plays a crucial role in identifying the most common hereditary form of iron overload. Testing for mutations in this gene helps detect at-risk individuals early, so they can take steps to protect their liver health and reduce the risk of developing liver cancer caused by iron damage. Always consult a healthcare professional for personalized advice and testing options, as each person's situation is unique.